If you feel like your erections are getting weaker, fading quickly, and aren't as strong as they used to be, it's not about age. It's about your blood flow. And the good news is, I'm going to show you how, without medication, without devices, just simple routines you can start anytime. Hi, I'm Julia. Today, I'm going to show you 5 simple routines that can change how your body pumps blood to vital areas. One of them is an ancient breathing technique that doctors rarely talk about, but it's proven to lower blood pressure and strengthen erections in just 4 weeks. Before we dive into exercises or breathing techniques, many men over 60 immediately look for solutions through supplements. But the most impactful first step is actually what you consume every day. Let's start with the simplest, food. I'm sure these ingredients are rarely known, but they have amazing effects and directly impact the quality of blood flow throughout your body, including to your vital organs. We'll start with fruit. Ever heard of Montmorency cherries? This type of cherry is high in polyphenol and has been proven in several studies to help blood vessels function more flexibly. Then there's wolfberries or goji berries. This fruit is rich in antioxidants and natural nitrates, ingredients long used in traditional Chinese medicine to improve blood flow. Moving on to the group of fish. Try switching up your meals occasionally with eel or onagi, which are commonly eaten in Japan and Korea. They're high in omega-3, which is great for maintaining the elasticity of your blood vessels. If you're more familiar with anchovies, those small, salty fish often found in Mediterranean diets, they're also excellent. Besides being rich in omega-3, anchovies contain L-arginine, a key component in forming nitric oxide, which is crucial for naturally widening blood vessels. Staying with seafood, there's prawns. Not only are they high in protein, but they also contain selenium and L-arginine, a combination that helps the body produce nitric oxide while providing antioxidant protection. And if you're not the type to regularly eat fish, don't worry, nuts can be your savior. Take Brazil nuts, for example. They're rich in selenium and phytosterols, 2 compounds that help keep nitric oxide active in the body. Pine nuts are great too, as their unsaturated fats support the health of the endothelium, the lining of blood vessels that's key to smooth circulation. Then there are flax seeds, which contain L-citrulline. You can mix them into your morning smoothies or oatmeal. And don't forget pumpkin seeds, common in the Middle East and Latin America, which are rich in magnesium and L-arginine, both excellent for circulation and relaxing blood vessels. The best time to consume all these is in the morning or during the day. That's when your body is actively digesting and absorbing nutrients, maximizing their benefits. However, you don't have to change all your meals at once. Just add 1 or 2 of these ingredients to your daily menu. For example, start by adding fresh fruit in the morning or swap your afternoon snack with pumpkin seeds or Brazil nuts. Remember, this isn't about eating healthy. It's about fueling your body with the right stuff to help your blood flow more freely, without obstacles, without pressure, and right where you need it most. Is your food helping to improve your blood flow or doing the opposite? Leave a comment on which ingredient you want to try this week. Now, let's move on to the second routine, and this one you might not have heard of before. It's called Qi Gong. While this practice isn't as well known as yoga, its effects are amazing, especially for men over 60 who are starting to feel easily tired, tense, or off balance. Qi Gong comes from Chinese tradition and combines gentle movements with steady, deep breathing. Interestingly, Qi Gong is more than just light exercise. It's designed to get blood flowing throughout your body, including your hands, feet, and brain, while activating the parasympathetic nervous system, which is the part of your body that helps calm the engine. When this system is active, blood pressure drops, stress decreases, and your body naturally relaxes. But that's not all. Many men don't realize that Qi Gong movements also help strengthen the pelvic floor muscles and improve balance. These 2 things are key to vitality in older adults. Pelvic muscle control affects the quality of erections and ejaculation, and balance keeps you active without the fear of falling or injury. If you're curious about how to do it, Qi Gong can start with very simple movements. Stand with your feet shoulder-width apart, relax your knees slightly, and keep your body upright but not tense. Inhale slowly through your nose while raising both hands slowly in front of you to chest height. Hold for a moment. Then exhale slowly through your mouth as you lower your hands back down to your sides. Repeat this movement 5 to 10 times, keeping a consistent and slow breathing rhythm. Focus your attention on the flow of air in and out. If your body feels warm or light after a few repetitions, it's a sign that energy is starting to flow more smoothly. You can also gently twist your body to the left and right while keeping your breath calm. No need to rush. In fact, the slower and more focused you are, the more noticeable the effects. And if you have trouble standing for long periods, all these movements can be done while sitting in a sturdy chair. The important thing is to keep your body upright, your breathing steady, and your mind calm. You can do this in the morning or evening, just 5 to 15 minutes a day. No equipment needed, no large space required. It can be done standing or sitting, depending on your body's condition. A recent study published in Frontiers in Physiology in 2023 mentioned that practicing Qi Gong consistently can improve endothelial function and blood vessel elasticity in older adults. Within 4 to 6 weeks, many start to notice differences, feeling lighter, more stable blood pressure, and better sleep. If you haven't tried it yet, maybe now's the time. And if you've tried Qi Gong before, I'd love to hear your story. What did you feel after a few weeks of practice? But all those movements and breathing techniques won't work their best if the most basic foundation is ignored. Yes, this third routine often gets underestimated: hydration. Drinking enough water every day might sound trivial, but for a 60-year-old man, it can be the difference between an active body and one that constantly feels weak, sluggish, and even struggles with erectile issues. Drinking water helps maintain stable blood volume. This means blood can flow smoothly throughout your body, including to vital tissues that rely heavily on circulation during a sexual response. But that's not all. Staying hydrated also plays a big role in keeping your prostate healthy. When your body has enough fluids, your urinary tract is more active in flushing out bacteria and waste that could trigger inflammation. Inflammation in the prostate is one of the most common causes of sexual dysfunction in men over 60. If you often feel easily tired, dizzy, or moody, the issue might not be your hormones or diet. It could be a lack of water. In fact, more than 30% of seniors in America experience chronic dehydration without even realizing it. Why? As we age, our sense of thirst diminishes. Many people also have a habit of drinking coffee, tea, or soda, which are diuretics and cause fluids to leave the body faster. Plus, medications like diuretics and blood pressure reducers can decrease your body's fluid levels without you noticing. This kind of dehydration is silent but dangerous. Blood becomes thicker, slowing down circulation to vital organs and increasing the risk of fatigue, urinary tract infections, and even prostate issues. When blood flow is compromised, sexual function declines as well. A 2025 Harvard Health study concluded that older men who regularly drink enough water have significantly better stamina, sexual vitality, and cardiovascular function compared to those who are less hydrated. Staying hydrated also helps your organs work more efficiently and minimizes the side effects of daily medications. So, the question now is, have you had enough water today? If not, there's an easy way to fix it. Place water bottles in key spots: your bedroom, living room, or desk. Want reminders? Use a smart bottle that automatically notifies you if you forget to drink. Apps like Hydrate Spark, Waterminder, or My Water are very popular, especially among men over 60 who want to stay disciplined about their hydration. The trick isn't to drink a lot at once, but rather a little bit at a time, sip regularly throughout the day. In the morning after waking up, midday after eating, and at night before bed. This is way more effective than forcing yourself to drink a lot all at once. Now, I want to ask, how many glasses of water have you had since you woke up this morning? Have you ever tried using a digital reminder or a special app to keep yourself hydrated? If not, maybe it's time to give it a shot. Staying well hydrated is a crucial foundation. Once your blood flow is smooth, the next task is to ensure that your pelvic floor muscles are strong enough to support optimal erections, ejaculation, and bladder control. This is where pelvic floor exercises play a very important role. Many men over the age of 60 start losing strength in an unseen area, the pelvic floor muscles. Yet, that's exactly where the main control for sexual function and even self-confidence during activities lies. Pelvic floor exercises, commonly known as Kegel exercises, aren't just for women. For men in their 60s, these exercises have been clinically proven to help strengthen erections, prolong the duration of intercourse, and reduce the risk of incontinence or difficulty holding in urine. The Mayo Clinic even features stories from elderly patients who say, "I started doing Kegel exercises after my urologist recommended them. Within 2 months, I could last longer during sex and no longer feared incontinence when laughing or coughing." You can do these exercises anytime, even while sitting watching TV, waiting in line, or during any activity. You don't need any equipment or a special room. Just focus and stay consistent. It's really simple. Imagine you're holding in urine for 5 seconds, then slowly release. Do this 5 times per session. Once you get used to it, increase to 10 to 15 times per session and do 2 to 3 sessions a day. But be careful, a lot of men do this incorrectly. Instead of working out the pelvic muscles, they end up tensing their abs, thighs, or outer buttocks. The muscles you need to activate are between the genitals and the anus, without any movement from the hips, buttocks, or thighs. Focus only on the internal muscles. If you're having trouble feeling the right contraction, you can use biofeedback devices like the LV Trainer or Perivit. These tools are commonly used in the US and help you know exactly when your pelvic muscles are active, making your exercises more effective and targeted. These exercises aren't just claims, they're backed by major studies in the Journal of Urology 2023 and a Mayo Clinic report in 2025. The results are consistent. Men over 60 who regularly train their pelvic muscles see significant improvements in erection strength, ejaculation, and bladder control. The side effect? A much more stable confidence during intimate moments. Now I challenge you, give it a try. Hold your muscles like you're holding in urine for 5 seconds, then release. What do you feel? Well, if pelvic floor exercises help build strength and control, then this is a natural way to keep your prostate functioning well and your system active. Regular ejaculation. For some men over 60, the topic of ejaculation might feel sensitive. But that's exactly why it's important to discuss. Ejaculation isn't just about sexual satisfaction. For men, it's a bodily mechanism that supports prostate health, mood stability, and even sleep quality. When you ejaculate, your prostate ducts are cleared of leftover secretions that could cause inflammation. This is crucial, as chronic inflammation in the prostate is one of the causes of sexual dysfunction and discomfort in the lower pelvic area. But that's not all. The ejaculation process itself boosts blood circulation to the pelvic area, helps maintain tissue elasticity, and stimulates the release of hormones like oxytocin and dopamine, which directly help stabilize your mood. How often should it be done? There's no hard and fast rule. But according to several large studies, including one published by Harvard in JAMA 2016, men who ejaculate more than 21 times a month have a 20 to 30% lower risk of prostate cancer compared to those who ejaculate less than 7 times a month. Of course, not all men over 60 can or want to hit that number, and that's okay. A frequency of 1 to 2 times a week is enough to provide physiological and emotional protective effects. What matters is quality, not performance pressure. Ejaculation can be done with a partner or solo, as long as it's done in a relaxed and pressure-free environment. If you want more noticeable psychological benefits, do it mindfully. Be aware of the physical sensations and your body's response, rather than just seeing it as a task to complete. And if you want stronger control effects, combine it with the pelvic floor exercises we discussed earlier. The combination of pelvic muscle contraction and mindful ejaculation can have long-term positive effects on prostate control, sexual satisfaction, and self-confidence. So, if you haven't considered this as part of your health routine, now's the time. And if you combine all those habits, the result isn't just better blood flow, but a body that truly comes alive from the inside. So, there you have it. 5 simple steps to mastering blood circulation and maintaining sexual vitality at 60 and beyond. Eat for better blood flow, practice Qi Gong, smart hydration, pelvic floor exercises, and regular ejaculation. The question now is, which one do you want to start with? Start with whatever's easiest for you. It could be one, it could be two. The important thing is to start today to boost blood flow, especially to your vital areas. And if you want more noticeable results, try combining 2 routines today. For instance, drink a glass of water this morning, then fit in some pelvic exercises tonight before bed. You'll be surprised at how quickly your body responds to simple habits like these. Don't forget to watch the next video for more tips relevant to men 60 and over like you. Stay healthy, stay fit, and never lose control over your own body.